Hi, I'm Ron Korthuis. I'm the professor and chair of the Department of Medical Pharmacology and Physiology at the University of Missouri School of Medicine. And I've had a long-standing interest in how we might protect tissues from the deleterious effects of prolonged ischemia and reperfusion, and became interested in preconditioning as a way to accomplish that. We were very much interested in potential interventions that would remain effective in individuals that have coexisting risk factors for cardiovascular disease like hypertension, high blood pressure, which is high blood pressure, and hypercholesterolemia as we age and smoke and so forth. And one of the things that we've seen in the epidemiologic literature is that consumption of alcoholic beverages is protective. And for some time, that protective effect has been attributed to the presence of agents that are antioxidants in alcoholic beverages, like resveratrol, which is found in red wine. And we became interested in the question as to whether the ethanol component could also be cardioprotective. And so began a series of investigations to see if that was the case, and it turned out to be true. And so, at least in these preclinical models. And so, in the course of studying these, how ethanol could confer this cardioprotection, we discovered that white blood cells that we normally think of as being beneficial in terms of taking care of bacterial infections, they play a deleterious role in tissues that have had their blood supply reduced and then reestablished, or what we call ischemia reperfusion. And as it turns out, ethanol paradoxically activates immune cells at a kind of a low level. It induces a stress within cells when we have an alcoholic beverage that causes protective proteins to be upregulated. In other words, we have more of them. And these protective proteins liberate their enzymes, and through their enzymatic activity, they produce a number of substances that are protective. And that was a rather surprising finding to us, but it's sort of consistent with this idea of hormesis, that is, that low levels of stressful stimuli seem to promote an adaptive protective mechanisms within cells that allow them to better withstand a more significant and severe stress later. And in this case, the more significant and severe stress would be ischemia and reperfusion.